Umatras at ayaw magpabakuna ng COVID-19 vaccine ang mga healthcare workers sa Amerika dahil sa takot na tatamaan ng side effects. Ayon sa ulat na inilabas ng Los Angeles Times, 20 to 50% ng mga healthcare workers ang umatras sa pagpabakuna sa COVID-19 vaccine matapos naranasan ang ilang side effects ng mabakunahan. Sa Providence Holy Cross Medical Center sa Mission Hills, isa sa 5 frontline nurse at doctors ang ayaw din magpabakuna. Sa Los Angeles County, 20 to 40% ng mga frontline workers ang hindi na rin magpabakuna. Sa Riverside County naman, halos 50% ang ayaw din magpabakuna. Sa ginawang survey ng Kaiser Family Foundation, napag-alaman na 29% ng mga healthcare workers ang ayaw magpabakuna, mas mataas kaysa 27% sa general population na ayaw din magpabakuna ng COVID-19 vaccine. Narito naman ang aktwal na report mula sa Amerika.
Vaccine is what most health experts say will end the pandemic once and for all, but some frontline healthcare workers are refusing to get vaccinated.
And in certain hospitals, the number opting out is significant. KCAL 9 Orange County reporter Michelle Geely has more.
It was a big moment for thousands of Southern California doctors, nurses, and frontline healthcare workers to get the COVID-19 vaccine. But KPC Health's Dr. Sumanta Chowdhury Saini quickly found out that members of her staff were choosing to opt out.
I was personally vaccinating healthcare workers. And I would say I was surprised when I would, ask a healthcare worker, okay, we can give you the vaccine now. Do you want to come in? And they would just say, no, thank you, not right now.
So far, nearly 3,000 employees at KPC Health's 7 hospitals have rolled up their sleeves. But in Orange County, 30 to 40% of the staff declined to be vaccinated. In Riverside County, the number is 25 to 40%. And at the one hospital KPC runs in San Bernardino County, 40% of the frontline workers there decided not to get the vaccine.
One did mention that they had an immunocompromised state. They had an inflammatory bowel disease, and they felt that they were worried that taking the vaccine might somehow worsen their condition. And I tried to allay their fears, but they did say that they just wanted to see how things went and over some time would reconsider taking the vaccine.
Dr. Chowdhury Saini hopes so. She says the greatest way to communicate to staff and the public that the vaccine is safe is for healthcare workers to get vaccinated.
We also have been giving information about the type of vaccine that it is, which is an mRNA vaccine, and kind of trying to educate as to why some of the greatest fears, namely people are worried that this is going to be incorporated into their own DNA and then somehow cause mutations and that kind of thing, why that's actually not possible. And we do have our infectious disease experts and other physicians and clinical folks helping to disseminate that information.
Vaccines are not mandatory for KPC Health employees, but they are strongly recommended. As for wearing masks at work, they will still be required, even for those people who have been vaccinated. In Orange County, Michelle Geely, KCAL 9 News.
Nangyari ang pangamba ng mga healthcare workers matapos nakaranas ng allergy ang ilang nabakunahan. Meron naman nagpositibo pa rin sa COVID-19 kahit nabakunahan na ng COVID-19 vaccine.
I think this illustrates that the vaccine effectiveness is not immediate.
Health experts weighing in after a local nurse tested positive for COVID-19 8 days after receiving the Pfizer vaccine. As ABC 10 News reporter Michael Chen tells us, a doctor involved with the local vaccine rollout says this case does not reveal anything about the vaccine's effectiveness.
This was a Facebook post from Matthew, an ER nurse at 2 different local hospitals after receiving the Pfizer vaccine December 18th. He tells me his arm was sore for a day, but he suffered no other side effects. 6 days later, on Christmas Eve, after working a shift in the COVID unit, he became sick, he writes in another Facebook post. He got the chills and later came down with muscle aches and fatigue. The day after Christmas, he went to a drive-up hospital testing site and tested positive for COVID-19.
Not unexpected at all, and when you work through the numbers, this this is exactly what we would expect to happen if someone is exposed.
Dr. Christian Ramers is an infectious disease specialist on the clinical advisory panel for the county's vaccine rollout. He points out it's possible Matthew may have been infected before receiving the vaccine, as the incubation period may be as much as 2 weeks. But Dr. Ramers says if Matthew did contract it after the vaccine, it's still in line with what we know.
And we also know from the vaccine clinical trials that it takes about 10 to 14 days for you to start to develop protection from the vaccine.
Dr. Raymer says he knows of several other local cases where healthcare workers became infected around the time they received the vaccine. He says all of these cases illustrate that results are not immediate. And even after you start receiving some protection, it is not full protection.
That first dose gives you, we think, somewhere around 50% protection, and then you need that second dose to get up to 95%.
Dr. Raymer says Matthew's story also shows that even with vaccines, the pandemic isn't going to turn around instantly.
Optimistic about, the vaccine being the beginning of the end, but it's going to be a slow roll for weeks to months as we roll out the vaccine.
Michael Chen, ABC 10 News.
Dr. Ramers says this case is a good reminder of why masks, hand washing, and other protocols are important even after receiving the vaccine. Meanwhile, Matthew tells us he's feeling better since his symptoms peaked Christmas Day, but he still feels tired.
Meron din biglang hinimatay matapos ang 15 minutes na nabakunahan ng COVID-19 vaccine.
Are we gonna pass them out? We can pass them out. Did he give them all? Alright, you ready?
Yeah. Had to be first. Yeah. They said I used up the only money. The large cage. Thank you very much.
Thank you. No. Be great. From where?
That's the last thing.
So, if you'll tell them your name. My name is Tiffany Dofer, and I am the manager in CCU. For my team, this has been it's been a hard time. We've persevered through it, but I think that this vaccination offers us hope. And, the fact that we can be proactive versus reactive, it's going to change the way this virus is taking over our lives. So I'm just thankful that we have a chance to receive it here.
How has it impacted your life?
For me, I have, seen my staff have to learn a whole new world of nursing. We have truly stepped up, and people have picked up shift after shift to help cover as this has surged, and truly our team has united together. It's between the physicians, my nurses, respiratory, we've all worked to try to give the best care possible. And it's been a challenge, but we have rose to the occasion, and I'm thankful for this team.
When you woke up this morning, did you know you were going to be receiving the vaccine?
I did, yes.
Okay.
So, all of my staff, we are excited to get the vaccine. We are in the COVID unit, so therefore, my team will be getting first chances to get the vaccine. And I know that it's really, I'm sorry, I'm feeling really dizzy. I'm sorry.
I'll sit down.
You can step away.
Whoa.
Turn the camera.
Ito ang mga aktwal na pangyayari sa patuloy na mass vaccination sa bansang Amerika kung saan mas dumami pa ang tinamaan ng COVID-19 sa nasabing bansa.